Okay, so in this video we're going to be talking about standing controlled articular rotations for the hip joint. Now, before we get into it, it's good to understand that the intention behind doing a controlled articular rotation is to not only move within the three planes of motion, but learn how to transition between them. Okay, so as we go through this controlled articular rotation for the hip, just think about it. Can you squeeze a little bit more as you make these transitions? Because where you see that deficit or that drop when changing from adduction into sagittal flexion into abduction, those are the ranges or areas or part of the joint workspace that you're going to want to spend more time on when you train. So this is in and of itself a sort of assessment or diagnostic tool for you to use to be able to be more specific with your training. So let's get to it. I have a pole. You can use a dowel, whatever you have, or even a wall. So pretend there's a wall next to me. I like to have it as reference because it does a really good job of kind of guiding me in terms of my intention when I go through this motion. And it's going to really serve to help you understand where I'm trying to create force. So I'm going to start with my right leg, and I'm going to go into adduction by crossing my foot over the midline. I'm trying to put my foot on this pole or wall or whatever you have. And then from here, I'm going to start to bring my knee up towards my chest, but I'm going to keep my foot on this pole. And then I'm going to let my knee go out towards the midline. So I'm abducting. I'm going into external rotation, but I'm still flexing. Now when I reach maximum flexion, abduction, external rotation in this position, I'm going to come off of this pole or wall, and then I'm going to drive my knee up into pure flexion. Then I'm going to come out into abduction, all the while trying not to let my pelvis come along for the ride. When I max out this abduction, I'm going to turn around or flip over so you can see. When I max out this abduction, I'm going to try and keep my knee as high as possible as I transition into internal rotation and abduction. So right now my knee is coming straight out to the side. Now from here, I'm going to go into hip extension. Notice how I'm not leaning, I'm not pitching, right? I'm just going to pure hip extension. When I'm in pure hip extension, I come into adduction. And then back down, knees together to the starting position. And so to reverse it, I gotta catch my balance there. To reverse it, I donkey kick into hip extension. I maintain hip extension as a abduct. When I reach maximum abduction, I'm going to start to externally rotate and keep abducting as I bring my knee towards my armpit, and then I'm going to come up, back towards the middle. So if I flip over, now we're back here, right, in sagittal pure flexion. Then I'm going to come into adduction. I'm going to start to externally rotate, and then I'm going to start to slide my foot back down to the start position, right? So we went into adduction. As we started to flex that hip, our foot was coming up, our hip was coming into hip flexion, abduction, external rotation. Then we go from external rotation, we slowly transition into neutral. And as we abduct, we start to internally rotate and then go into abduction. Then we start to extend the hip, then transition back down into adduction. So you see how we go through these three planes of motion, but we learn how to transition through them at the outer limits of motion. That's the purpose of using a controlled articular rotation, because it really teaches you a lot about where in that end range you're weak. And this will definitely highlight some of those deficits. Whew, I'm out of breath. So if you do this right, you'll really get to learn a little bit more about your joint workspace at the outer limits of motion. You can use it to assess, train, even rehab, because as you start to do these more and more often over time, you're going to get better and better at capturing some of that range, and it's going to really allow you to try and close that gap between the passive flexibility you probably have within those planes of motion and the active control you have getting into those and transitioning through those ranges. So give it a shot, and I'll see you next time. Peace.